Hi everyone, welcome back to Spill the Health, Real Talk, Real Health. Today we are very privileged to have our thoracic surgeon, Dr. Ben, with us today. Hi, Dr. Ben.
Hi.
Dr. Ben, have you heard about the recent announcement about from the Ministry of Health of Malaysia?
Yes, I did. If I'm not mistaken, recently our Health Minister, Datuk Sri Zulkifli Ahmad, announced that the Ministry of Health is seriously looking into this issue of implementing a nationwide ban on the sales of e-cigarettes as well as vape products. And if you ask me, this is actually a good move by the Ministry of Health, as we are seeing more and more of what we call lung conditions, or what we term as e-valley, e-cigarette and vape-associated lung injury creeping up in our community.
I see. So doctor, actually a lot of people, they have an impression that vaping is actually a healthier option compared to normal cigarettes. Like, what's your opinion about this, doctor?
Okay, I think that is a myth because of course, when you see people smoke, secondhand smokers do smell the smoke. It's a bit unpleasant and all. Whereas what we do with vapes and e-cigarettes, it's flavored. Sometimes the secondhand smokers don't get the smell of the smoke. But you have to bear in mind that these e-cigarettes and vapes also, it contains chemicals. So the way it works is different than cigarettes. In vapes and all, it actually aerosolizes this nicotine and this chemical. It is dangerous. You are inhaling more chemicals, and it actually can cause more damage to the lungs compared to the cigarettes.
I heard there's formaldehyde inside.
Yes, there is. It is one of the components in the vapes as well.
Yeah, so everyone bear in mind that formaldehyde is something that we use, a very toxic chemical that we use to preserve dead bodies. And it is also carcinogenic. So those people that vape, you really need to listen to this. Okay, so doctor, a lot of people, because we know that vaping is actually very dangerous, right? So people definitely, they will have two things in mind. Number one, if let's say I stop vaping right now, will my lung recover? And number two, if I would like to stop vaping, how should I start? Because it's not easy for people to quit vaping. So I would like to hear from you, doctor.
Okay, so what happens when one vapes? Of course, this chemical product in the vape causes inflammation. So when an inflammation in the lung happens, it causes some degree of damage, and lungs heal by fibrosis. So the longer you vape, the more the damage, and potentially these damages are irreversible. So in the early period, you may recover well, but the longer you vape, the more damage is to the lung, and you will not be able to reverse the damage at all.
So that means, that is just now, doctor, you mentioned that there will be scarring in the lung.
Yes.
I see.
Yep. So scarring happens, and this scarring will remain permanent.
Okay. So if let's say I stop vaping right now, I have the chance to recover. But if let's say I keep on vaping and keep on delaying to quit vaping, then that means the damage will be like more and more.
Yeah, it will be irreversible.
Okay. So if let's say we would like to stop vaping, for example, someone vapes for a long time already and they would like to start. Definitely, it's not a very easy journey. Is there any tips that you can share with those people that you would like to stop vaping?
In essence, what causes one person to be addictive to vaping and cigarettes is the nicotine.
I see.
Okay, so there are a lot of other products out there. A lot of initiative by the government as well in terms of quit smoking clinics as well, where they do provide a sort of supplement or to the nicotine that's inhaled. They do have nicotine gums, they have nicotine patches and all that. That doesn't really affect the lung. Okay? So my advice is a person can go to clinics, seek the advice of the doctor, and they do have quit smoking programs that these people can be enrolled into.
Okay, all right. So one more question that I have in mind is because we know that secondhand smoker, if let's say people are smoking normal cigarettes, secondhand smoker is actually are very they put themselves at a very big risk to actually get lung cancer. How about those people that inhale the smoke from secondhand smoker from vaping?
Well, the data that is there is still premature. We don't have significant data to suggest whether second-hand smokers do actually get affected by this e-cigarettes and also vape or not. It will take another few years to look at the data, then that's when we can come to a conclusion that second-hand smokers also do get affected by e-cigarettes and vapes.
Okay, all right. Doctor, we have heard a lot of cases about smoking causing lung cancer. So what is actually the risk of vaping towards lung cancer?
Okay, Malaysian context itself, the data is still not very sufficient. Because I think vape became more popular in Malaysia in 2010.
Okay.
So now it's only about 15 years down the line. Probably we'll need another 10, 20 years to see what is the actual damage. But there are countries that have done studies on this. And what they deduced is the risk of developing lung cancer from vaping and utilization of e-cigarette is actually 4 times higher than cigarette.
Ooh. So that means it's really, really high on this one. Probably it's because of the chemicals inside.
Yes. So what actually happens, as I said before, these chemicals actually induce inflammation. And once inflammation happens, this actually predisposes to cancerous changes.
I see.
Yes. What is worrying now, a lot of youngsters are picking up vaping and e-cigarettes. And I've seen some teenagers who come with pneumothorax because of vaping. Basically, what happens is this vapes and e-cigarette actually damages some parts of the lung, whereby there is a bit of a leak, or air leak from the lung itself. Means that part of the lung that is unhealthy ruptures, and then the air that it's supposed to be exhaled out gets entrapped in the patient's chest cavity, and that's what we call pneumothorax. And these patients end up with surgery to actually deal with the damaged part of the lung.
So, doctor, we talk about lung cancer, and in Beacon Hospital, we do have something called LDCT that we can actually use to use it for lung cancer. Doctor, could you explain more about this LDCT and how it can actually help patient to, especially for lung cancer patient, and also for those people who like to prevent themselves from getting lung cancer? Okay.
As you know, majority of patients who present with lung cancer, they do not have symptoms. So that is why in Malaysia, when patients present, more than 90% of them come in stage 3, stage 4 because they don't have symptoms.
I see.
So what we are doing now is utilizing LDCT. LDCT means low-dose CT scan as a screening tool to detect lung cancer. Means screening is where you pick up the disease when the disease or the symptom doesn't become apparent. And right now, globally, LDCT is the gold standard because it is highly sensitive to pick up small lung nodules. So if you manage to detect these lung nodules when it's still small at an early stage, treatment is actually more effective and the outcome is better.
I see. So you definitely suggest this LDCT to be done by just normal people that haven't got lung cancer before, or you will suggest this to those people that have lung cancer already?
Okay, there have been studies that actually risk stratified some patients to say that they are high risk population. Yes, of course, if an individual is in the high risk population, means that they have smoked more than 30 years, they have a strong family history of lung cancer, first degree relative, or they have chemical exposure, radon exposure during their work, it is recommended. And what is worrying now, we are seeing the other trend that we are seeing lung cancer cases without any apparent risk factors.
I see.
So yes, anyone who are a bit concerned about their well-being, their health, can go for this screening.
Okay. So Dr. Ben, so after the announcement from Ministry of Health, what is actually the current landscape of the ban?
Okay. At this moment, the ministry just announced that they are looking into it because a lot of factors to factor in, and they have to do a more thorough research on implementing a nationwide ban. We do not have a nationwide ban on the sales of vapes and e-cigarettes, but some states have taken the initiative. We have at least 6 states in Malaysia that have actually implemented a ban on the sales of vapes and e-cigarettes in the respective states. Johor being the pioneer, and I think they implemented it since 2016.
I see. So, what do you think? What's your opinion about this ban, Doctor? And how do you think the ban will actually lower down the number of people who vape?
It is encouraging because you can see that the states are taking the initiative. They've actually they do realize that vapes are actually a problem, and that is why they've come up with this. Hopefully, with this ban, the sales will come down, but it's going to be in that states alone. People are going to cross borders and buy vapes and e-cigarettes from the neighboring states.
But definitely there will be like a bigger challenges for them to actually go and buy the vape.
Yes.
So that means if people start to think that it's actually very hard for me to go out to buy the vape, then I'll choose not to vape.
Yeah, possible.
Yeah. Okay. Thank you very much, Dr. Ben, for your time to share about the dangers of vape and also how to actually protect our lung from getting cancer, especially in this World Lung Day. Thank you very much, Doctor.
You're welcome, and thank you for inviting me to give this to share my experience as well in this matter.
Thank you, Doctor. With the initiatives from Ministry of Health to ban the sales of vape in a few states actually encourages those people that would like to stop vaping to start now. Let's take the step to protect our lung and our life. Spill the Health, real talk, real health.